Hi everyone. Today's class is about Introduction to Tooth Preparation and Materials. Our specialty, conservative dentistry and endodontics, deals with protecting the tooth from not getting extracted. There are several reasons for a tooth to get extracted from the tooth, from the oral cavity, like dental caries or other defects or injuries. So our specialty deals with preserving the tooth as much as possible and to retain it in the oral cavity in its natural form. So we do a certain kind of restorative therapy to protect the tooth from getting extracted. So it basically basically stops the progression of the dental disease, like dental caries or other erosion or other defects, and it also restores the tooth's normal form and function. So, for that thing to happen, for restoring the tooth into its normal form and function, and to stop the progression of dental disease, we need cavity preparation or tooth preparation. And also, we need certain materials to replace the lost tooth structure. To understand this thing in detail, we will go in deep into the cavity preparation designs and materials which is commonly used in restorative dentistry. So teeth can develop carious lesion or can undergo fracture or loss of substance due to abrasion or erosion. So here, as you can see in this picture, the tooth, the first picture depicts the picture of a dental caries lesion. This is dental caries in action. That is, a tooth is destroyed due to microorganisms which ferments the carbohydrate and produces acid, which causes dissolution of enamel, dentin, or the mineralized structures of tooth and causes destruction to the tooth structure. The second picture is the picture of an abrasive lesion, which can occur as a result of any abrasion, which can result by using excessive forces that is used during brushing, or maybe due to eccentric forces acting on the tooth. So all these contribute to the loss of tooth structure. And why do we need restoration? Because there are several numerous dental pathology that exist in the oral cavities can affect the tooth. And all these dental caries or pathology can result in loss of structural integrity of the tooth, and which can sometimes result in pain and other symptoms. And of course, if the structure is lost, the function is lost. So there is loss of function. And also there is aesthetic concerns. The patient, if a front tooth is having dental caries, which can result in aesthetic concerns for the patient. So the patient needs to correct that defect. So uh, so for removing the caries or the defective dental pathology and for restoring the tooth to its normal form, we need certain tooth preparation design. It is obvious that we need to remove the defective structure. We know that the dental caries can cause destruction to the tooth structure. So it is a defective area in the tooth. So we need to remove that defect first, so that restorative material or another material can replace its original form and function. So here in this picture, you can see that the pit and fissures of this molar is affected by dental caries. And the second picture, all those defective structures is removed. So basically, this procedure is known as cavity preparation or tooth preparation. So this cavity preparation will permit placement of a material that will restore the tooth's original form and function. As you can see in this picture, the defective tooth structure is completely replaced with another material that harmoniously replaces the normal form of the tooth. So for this to happen, we need this, that is the tooth preparation. So that is the aim of tooth preparation. And so let's discuss about the definition of the tooth preparation. So what is tooth preparation? Let's see its actual definition. The tooth preparation is the mechanical alteration of defective, injured, or diseased tooth to receive a restorative material that re-establishes a healthy state for the tooth, including aesthetic corrections when indicated and normal form and function of the tooth. So basically, it is a mechanical alteration or the mechanical preparation of the tooth surface that removes the defective or injured tooth structure And for what are we doing this? We are doing this to restore, to facilitate the placement of a restorative material that would reestablish the healthy state of the tooth. So basically, that is the definition of tooth preparation. And for tooth preparation, there are several. It depends mainly on two factors. There are several methods by which we do it, and all this depends upon basically two factors, that is the extent of damage of the tooth structure and also the type of the restorative material which you are using to replace the damaged structure. So the if the caries lesion is so extensive, we need that kind of material to restore it. So it is interrelated. The tooth preparation designs is can vary according to the material which is used to restore tooth, and at the same time, the material which is used to restore the tooth can depend upon the extent of the damage of the tooth. And for the dentist, there are special drilling instruments that are used at varying speeds in combination with hand and in combination with hand instruments for cavity preparation. We have dental drills which works at different speeds, which is used for removing the defective caries lesion and to prepare the tooth surface. So, and there are also certain hand instruments besides rotary instruments which are used for preparing the tooth. There are several challenges for preparing a tooth for restoring. The first thing is that we know that tooth is a very tiny structure. We are working on which an area of we are working on an area whose area is diameter is about 3 to 2 mm. So the cavity preparation should be completed with great care so that all important design features are incorporated. We know that the cavity preparation needs certain features according to the type of material which is used. And also, at the same time, the cavity preparation should avoid encroachment into the underlying vital pulp tissue, which are contained as the core within the teeth. We know that inside the that is inside the enamel, inside the dentine, there is dental pulp, in which there is blood vessels, nerves, and all important structures. So, when we prepare a cavity, we should not encroach this dental pulp. So that these two things are taken into consideration when a tooth preparation design is planned on the patient. When a cavity is prepared to remove a caries lesion, it is typically slightly larger than the size of the lesion itself. It is obvious that if you want to remove the dental caries, the cavity shape will be slightly more than the defect itself, because the margins of the cavity should rest on the sound tooth structure. On the tooth surface, it has an outline form which refers to the perimeter of the cavity. So this is an important terminology, that is the outline form. It defines the perimeter of the prepared cavity or tooth preparation. And it is also it is usually larger than the perimeter of the caries lesion. So the outline form of the cavity, that is the line of demarcation which defines the extent of cavity, is usually slightly larger than the perimeter of the caries lesion, and it should rest on the sound tooth structure. So cavity preparation designs, as we discussed earlier, that vary according to the extent of damage and type of the restorative material to be used, and the cavity must have certain features incorporated in its form to ensure longevity of the restoration. So this summarizes what we have discussed till now. That is, for correcting defective tooth, we need certain preparation on the tooth surface so as to facilitate uh, for the placement of a respirative material. And at the same time, the cavity preparation should have certain subtle features that would help the respirative material to stay within the tooth. And the cavity preparation designs vary according to the extent of the caries lesion, and also depends upon the type of the restorative material that is used to restore the tooth. So this is what we have discussed so far. These two lines summarizes that the things which we have discussed so far. Now we will see certain features of the cavity preparation. which is typically referred to as retention and resistance form. And these are the subtle features which is incorporated into the cavity preparation that helps in the retention of the respiratory material. The first one is retention form and second one is resistance form. Let's see what is this in detail. The first thing, the retention form represents the features that enables the cavity to retain a respiration in place without moving. For example, in case of amalgam restoration, amalgam restoration is basically a mechanical restoration. It does not chemically bond to the tooth structure. So it stays within the tooth structure according to the mechanical features that we incorporate into the cavity. As you can see in this picture, the first picture represents a box with having parallel walls. So if we put material like amalgam into this and we turn it upside down, the material is going to fall because the material is not sticking onto the walls. On the other hand, if we prepare a cavity like this and put amalgam inside it and we turn it upside down, it is not going to fall off because it is having an convergence towards the top. So in the cavity, we create a feature known as occlusal convergence, which is the retention feature of a amalgam cavity preparation. So all these features depends upon the material which is used. Here, the retention form or retention feature is the occlusal convergence when amalgam is taken as the example. And another feature is the resistant form, which refers to the cavity design that prevents the fracture of either the restoration or the tooth itself. Here in this picture, you can see that if a cavity preparation is having a rounded form like this, it will rot inside the tooth on functional movements and will cause the fracture of the tooth. That it can cause fracture lines and can result in the fracture of the tooth and the restoration itself. On the other hand, if the cavity is having proper boxy shape with round internal line angles, it will resist the rocking movements, which is known as the resistance form. So these are the two important features that we incorporate in the cavity filtration, which helps the restoration to stay in the tooth for a longer period of time. And the thing which we need to understand is that all these factors depend upon the type of the restorative material used. Here in these slides, I explained these features by taking amalgam as an example. For composite restoration, it is another type of restoration which is used to restore the tooth. The features is entirely different. There will be other resistance form and other retention features which is incorporated into the cavity. So all this depends upon the type of the material which is used to restore the tooth. Coming to the classification of dental caries, J.P. Black, who is known as the father of modern dentistry, modern operative dentistry, he introduced a classification system which consists of class 1, 2, 3, 4, and 5. And later on, additional classification, that is class 6 restoration, cavity preparation was also added to that list. So let's see what is this cavity preparation designs. Class 1 tooth preparation is the tooth preparation involving pit and fissures of caries. Pit and fissure caries. That is, it involves the occlusal surface of posterior teeth, lingual pits of upper incisors, and incisors in canines, and buccal and lingual pits of molars. So basically, it involves the occlusal pit and fissures of posterior teeth, and also the lingual pits and buccal pits of all of molars and all tooth, and also the lingual surface of anteriors. So here in this picture, we can see that this cavity involves the occlusal surface and also extend to the palatal pit. Here, similarly, in the lower molar, it extends to the buccal pit. So it is basically cavity that is involving the occlusal surface of posterior tooth, lingual pits of upper incisors and buccal, and lingual pits of molars. Here in class 1 cavity involves the lingual pit of the incisor. And what is class 2 preparation? It is a tooth preparation on the proximal surface of premolars and molars. In the previous classification, the cavity was involving only on the occlusal surface, but here it involves on the proximal surface, that is on either on the mesial or distal or both. And sometimes the preparation may be prepared in combination with the occlusal class 1 cavity or they can occur alone. Sometimes the cavity preparation is made, we prepare a class 1 and there is caries here, we will extend it to the proximal surface. And sometimes if there is no caries on the occlusal surface, we prepare the proximal surface alone. So this is the cavity preparation for amalgam preparation, and this is a cavity preparation for composite restoration. So it depends upon the material which is used to restore, and also depends upon the extent of caries lesion. Coming to class 3 tooth preparation. Class 3 and the next cavity preparation, that is class 4, is exclusively on the anterior teeth. That is the proximal surface of the anterior teeth. And the main difference between class 3 and class 4 is the involvement of the incisal edge. This is the incisal edge of an anterior teeth. Here also. So class 3 preparation is done on the proximal surfaces of incisors and canines without involving the incisal edge. Here in this picture, you can see that the incisal edge is not involved. Here also the incisal edge is not involved. So class 3 preparation is basically on, which is a preparation on the proximal surface of incisors or anterior without involving the incisal edge. So the class 4 preparation will be naturally the preparation on the proximal surface of incisors and canines involving the incisal edge. In this picture, we can see that it involves the incisal edge. As you can see in this diagram also, it involves the incisal edge of the tooth. So that is class 5 and class 3 and class 4. Now, class 5 tooth preparation. It is the tooth preparation on the cervical 1/3 of labial surface of incisors and canines, and on the buccal and lingual surface of premolars and molars. So it is basically on the cervical 1/3 of all teeth, that is on the anterior surface of canines and on the incisors, and on the buccal or lingual surfaces of posterior teeth. So it is basically the cervical third of all the teeth. Next is the class 6 preparation, which is the latest addition into the black cavity preparation design. It is the preparation on the incisal surface of anterior teeth and also on the cusp tips of canines, premolars, and molars. In this picture, you can see it is on the cusp tip of a premolar. So that is the GP Black's preparation of cavity, that is class 1, class 2, class 3, class 4, class 5, and finally class 6. So now, so far we saw the different types of cavity preparation and displays. In the first initial slides, we discussed the need for cavity preparation. Why are we doing cavity preparation? What is the aim of preparing the tooth? Why are we cutting away so much tooth material? And then we see how we are preparing the tooth, what are the designs which is incorporated, what are the different features, what are the classification of cavity preparation. And now it is time to discuss about the materials which is used for restoring the teeth. So what are the materials which is used for restoring the teeth? So we have prepared the cavity. Now it's the time to restore it. So we need to discuss about what and all materials can be used to restore the tooth to its normal form and function. The first material and the most popular material is the dental amalgam. It is a very old material which is introduced about 100 years ago, and there are several. Initially, there are several formulas for it, and later on, the technique was refined. G.V. Black played a major role in determining a definite composition for the dental amalgam. And from that period onwards, the material was very popular and it is still used now, but slowly, due to many reasons, the use of dental amalgam is greatly reduced nowadays. But it's still an important and very popular material. So dental amalgam is the first material which we are going to discuss in this area, that is the material used to restore the tooth. The amalgam is basically available in alloy form, and it is mixed with mercury to produce the amalgam mixture. And this amalgam goes into the tooth and it is condensed into the tooth surface. And after a particular amount of time, the material sets. Before that, the anatomy of the tooth is carved on the tooth, and after some time, the material is set into a hard structure, and after 24 hours, it can be even polished. So there are several advantages and disadvantages for this material. The first advantage is that it is a metallic substance, so that it is having enormous strength, almost even to that of the, or even more than that of enamel. It can withstand masticatory forces very easily. It can be used in very large restorations. It can withstand forces of mastication very effectively. But the problem is that the materials, as you can see, it is not aesthetic. It does not have the color of that of a tooth. It's silver in color. Sometimes it can undergo tarnish, that is surface discoloration, and it can even appear as black. And also, since it is a metallic restoration, it can undergo corrosion, and these corrosion products can discolor the tooth. And also, there are certain thing known as galvanism, by which it is if there are too many metallic restorations in the patient's mouth, it can produce several electrochemical reactions and cause the degradation of the material. And also sometimes there is galvanic shocks can also happen. So there are several disadvantages for this material. And there is also a concern regarding the use of mercury for mixing amalgam, that the mercury can be can if it can leach out of the restoration and cause damage to human body, but it is not proven scientifically. So, taking all these features into consideration, dental amalgam is now slowly phasing away from the face of dentistry. It is slowly replaced by a new material, which is known as the resin composite. Resin composite is being introduced in late 1950s, and it has undergone several drastic changes throughout this time period, and it is perfected uh, throughout the history. So it is the most popular material now, and it is also aesthetic. It bonds to the tooth by means of micromechanical or even chemical bonding, and it has excellent biomimetic, that is, it mimics the body's normal tooth structure. And it is also having the most important feature is that it is aesthetic. It mimics the tooth structure. It is having the same color. Can be play. It can mimic the normal tooth color and aesthetics, as you can see in this picture. It is available in the form of tubes, in which it is available in the form of semi-solid, in which is adapted to the surface, and it is cured by using light. When we apply light of particular wavelength to the composite material, undergo polymerization reaction, and it sets. So we have infinite time for manipulation. That is, the working time is we have enough working time for the composite to be molded onto the tooth surface. And there are still so many other materials which is used for restoration of tooth surface. Some materials are used alone, and some materials are used in combination with other materials. The one important material is the glass ionomer cement. The glass ionomer cement has several advantages. The most important feature is that the property of fluoride release. The glass ionomer cement, when placed on the tooth, releases an ion known as fluoride, which has a property to arrest dental caries. So if it is placed on an active lesion, it can inhibit the progression of the caries lesion. And secondly, the glass ionomer can chemically bond with the tooth structure. It forms a stable chemical bond with the tooth structure, but it is not having enough strength and then compared to composite or amalgam. So a dental glass ionomer is not popularly used as a permanent restorative material, but it can be used in areas with less occlusal stress and and it is not so aesthetic as that of a composite restoration. Even though it is white in color, it is not as aesthetic as the composite restoration, so that we cannot use it in all situations. Sometimes it can be used as a liner, that is a material which is placed under permanent restorative material, that is, for example, amalgam or composite. And it is a very promising material, available in several forms, mostly in powder and liquid form, which is mixed prior to the placement in the oral cavity. Other materials which is available is the dental cements. Two of the most important dental cement is the zinc phosphate and zinc polycarboxylate cement. Zinc phosphate is a very old material which is used in combination with the dental amalgam. The zinc phosphate is used as a base below the amalgam restoration. We know that the amalgam is a metallic restoration. It can conduct heat from the oral cavity to the pulp. So below a deep amalgam restoration, we place a base of zinc phosphate cement so as to provide pulp protection, a mechanical and thermal insulation. Similarly, zinc carboxylate is another material which is developed for the same purpose. And one similar property of a zinc polycarboxylate property of the GIC is that it can also chemically bond to the tooth structure. So these are the basic, these are the important cements which is used in the restorative dentistry uh, in combination with other dental materials. So it besides acting as cements, these materials also has several other wider applications. So these are the important materials which is used to restore teeth. The first one, the amalgam, and second thing, the composite, and thirdly, different dental cements. And among these materials, the most important and most popular material is the resin composite. Amalgam is also important in as far as the dental curriculum is concerned. Most of the exercises is related to dental amalgam. But however, today's practice is solely so today's dentistry is mostly concentrated towards resin composite, and resin composite it is having had several advances during the recent years. And other materials like glass monomers and dental cements are also important when the restoration is restoration of tooth is taken into consideration. So let's recap what we have talked today. That is, firstly, initially we saw what is the need for tooth preparation, why we need tooth preparation, because veterinary tissue is affected by several diseases and injuries. So we need to correct them. So that we need certain preparation for the tooth on the tooth, so that particular material can be placed on the tooth surface. So that is the first point we discussed. And this cavity preparation is dependent upon the extent of caries and also on the type of the materials is used. And there are several challenges to cavity preparation. That is, we should not injure the pulp inside the tooth, and also there should be subtle features incorporated to the tooth onto the tooth, which will enhance the material to retain within the tooth and also prevents the damage of the tooth. And two of such features is known as the retention and resistance forms. And we discussed what these forms are. And then we discussed about the GV Black's 5 classification, that is class 1, class 2, sorry, class 2, class 3, class 4, and class 5 and class 6. And finally, we discussed about the different materials which are used for restoring the tooth. So we saw the dental amalgam, the composite, and other dental cells. So this is the nutshell of the today's class. Uh, that is the introduction to cavity preparation and design and materials. So we know so now we know why the tooth is prepared and what are the important materials which is used to prepare a cavity. So so we know that the tooth, whenever it undergoes a damage, need to be restored, and it need a cavity preparation for the defective material structures to be removed, and we need certain materials to fill the defective structure. So, having said this, I end this lecture. In the coming lectures, we'll talk in detail regarding the different cavity designs and shapes. So, you all will read about this this material in your textbooks. Thank you, and see you in the next lecture.